I'm going to tell you everything you need to know about cervical dilation and effacement. Stick around. Welcome to the Hypno-Baby channel. I'm Dr. Natalie Fizet. I'm a retired family doctor who delivered 3,700 babies. This is your channel, so don't forget to comment, like, share, subscribe, and be amazed. Of course, there's a big medical disclaimer. This channel is for entertainment only. You use it at your own risk. I am a doctor, but I'm not your doctor. Hi, I'm Dr. Natalie Fizet. So you want to know about cervical dilation and effacement. The cervix is the entrance of the uterus. It's usually thick like 2 fingers, if you can see my fingers here. To do a cervical exam, we use a glove hand. We use 2 fingers and we touch the cervix. We measure 2 things. We measure the dilation, which is the opening of the cervix. Usually before labor, the cervix will be closed, so that's 0 dilation, and it opens up to 10 centimeters. Why 10 centimeters? Because that's the size of the baby's head. So that's what we say is fully dilated, because then the baby's head can pass. The effacement is the thickness of the cervix, and if you see my fingers, if you only have one, you're 50% effaced, okay? As you can imagine, these measures are very subjective, because if a woman is in labor and we had 10 different persons, the students, the nurse, the doctors, the midwife, examine her, we won't do that, of course, but we would get 10 different exams, and it would range from, let's say, 2 centimeters to almost 4, to 0% effaced to 50% effaced. So it's really subjective. But once a person examines you, let's say your doctor examines you or your nurse examines you every time, she can compare with her own exam, so she has the same bias, if I could say so. By the way, one of my pet peeves is medical errors in movies or television series. And ER, don't know if you know about the television series ER, the drama series. It was really good, and medically it was almost flawless, but often they would have a pregnant woman being rolled in the emergency room, and they would say she's fully dilated and then 100% effaced. What's wrong with this picture? If you're fully dilated, there's no more cervix to touch, so you don't know if it's 100% effaced. So every time it would get me, and they would say that, Dr. Green would say that all the time. She's fully dilated, 100% effaced. If she's fully dilated, you don't know about the cervix. It might be 50%. So you might be wondering, does the cervix disappear? Does it regenerate? Imagine if I'm Canadian, so that's my example is going to be a turtleneck. So imagine I'm putting a turtleneck above my head. Okay, it's the same thing when your baby passes the cervix. So once I have my turtleneck, the neck is here. It did not disappear, but my head is out of the turtleneck. So same thing for the baby. The baby's head is out of the cervix, but the cervix is at this stage, and then it passes like the baby passes all its body, and then once the baby's passed, the cervix recloses. Even though the cervix recloses, it never recloses completely. Once you've had babies, often you might be like a little open, or the cervix will be more stretchable, and the more babies you have, usually the fastest the opening the cervix will go. So how does it go? Do you efface first and then dilate, or do you dilate and then efface? It depends. You can have all the combination possible. Usually a first baby, you'll efface first, you'll thin your cervix, and then you'll dilate. But again, you can have a combination of both. And when it's not your first baby, often you'll dilate, and your cervix might not go to 100% efface because it's already stretchable. So it might dilate fast and not thin completely. I was just reading about cervical dilation and effacement, and the article was saying it's essential to do an exam, and it's not. I've had a patient that was abused physically and sexually when she was young, and she said, I'm going to freak out if anybody tries to touch me there. And I said, sure, I won't do an exam. And when a woman is in labor, she came to the hospital because she had contraction and she had some showing and everything. I never examined her, and at one point she started like spontaneously pushing, like, and it is really clear. I always told my patients, you're not going to ask permission to push. It's going to come naturally. It's like the biggest stool you've ever passed. And sure enough, and at the nurse's station, like the other doctors were, you're not going to check her? You're not? No, no. She's going to start pushing eventually when she's fully dilated. So sure enough, she started pushing, and the baby, I started seeing little pieces of hair coming out, and the baby was born, and she never had a vaginal exam. So it is not essential. It's not like it would not prevent you from giving birth. So don't worry about that. If ever you've had some trauma, though, it's better that you ask for to see a psychologist and to get support, because the birth is kind of a very private event and it might stir some old stories. All right, you might say, oh my God, I went to my doctor's office and I see that in Facebook group. I'm 2 centimeters dilated, baby's coming soon. There's no prediction. Some women walk around at 4 centimeters for a very long time, and others have nothing. And once their labor starts, the good contractions that make you dilate any face, they go in labor and they had no opening before and no thinning. So there's no predictive value in the exam. It does tell you I'm starting at 2 or I'm starting at 4 centimeters. Women who've had babies, like I said, the cervix doesn't reclose completely and it's more stretchable. So it's easier for them if they decide to have an IUD put in, because the IUD kind of slips through the small opening they already have. So it's easier if you've had babies to have an IUD put in. So the last thing I want to mention very briefly is some women suffer from what we call cervical incompetency. I'll say it. It's actually their cervix opens really too soon in pregnancy, sometimes at 15, 20 weeks, and they basically lose the baby. The cervix does not have doesn't hold the baby. It doesn't stay close. It's very rare that we can catch it on the first time that it happens, because it happens they just drop the baby at a way too early age to salvage the baby, to save the baby. But once we know that, on the subsequent pregnancy, we have to wait 10 weeks, because that's the period of spontaneous miscarriages. But after that, they can do what they call cerclage, or circling of the cervix. They basically do a stitch. If you look again at my cervix here, I'll do it on this hand, it's better. And they kind of sew here, and then they hold it. Doesn't always hold. Sometimes the cervix thins and pulls on the stitches, and that person can lose a baby. It's a rare condition, but it happens. I'm just telling you because we're talking about cervix. Others will make it to 36 weeks, and at 36 weeks, we don't want to hold the baby more than we have to, so they remove the stitches that they have, and usually they will go in labor very soon, because the cervix is openable. I've had a patient that had a cervical stitching like this, and once they removed it, she went 3 more weeks, which was really odd, because the first one she just opened and lost her first baby in a matter of minutes. So cervical incompetency is the condition. It's very rare, so don't worry. And you'll see in labor, you're going to have pull and stretch and everything with the contractions. You're going to go, well, those women that have cervical incompetency, that's not my case, because I really have to work to get the dilation and the effacement going. There's cool demonstration with a balloon and a ping pong ball, and they show you how the cervix changes, and how false contraction don't have any effect on the baby descending and the baby pushing in the cervix, and then the real contractions where you really push on the top of the uterus like a real contraction would do, and then the baby pushing on the cervix. These are nice. You can search them on YouTube or on the internet. I've seen one that the demonstrator was huffing and puffing and really getting sweaty, like giving birth, which was pretty funny. I'm gonna do mine differently. I'm gonna use a pantyhose because I'm intolerant to latex and I get like really fire on the lips if I blow up a balloon. So I won't do that. And I want to be different, so it's going to be with a pantyhose. But you're going to see how the baby pushes on the cervix and how the cervix does not disappear. It just goes like my example of the turtleneck. So put in the comment below if you're dilated, how many centimeters you are, if you've had cervical incompetency, if you still have questions about cervical dilation and effacement, just comment below. I want to hear from you. Bye. See you in the next video. So here's my little demonstration. So there's a baby in there, and that's the cervix that's thick and closed. As you can see, it's closed here. And I'll show you during labor what happens. So as you get contraction, it pushes on the baby, pushes, 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 and then the head starts dilating the cervix. That would be like halfway. That would be 5 centimeters. We're not at 5 because it's a small baby. But eventually, as I was saying, you can see that the baby passes the cervix. I'm sorry, I might be causing you pain seeing this, but the cervix does not disappear. It would be like here if you can see. Okay, and the baby pad continues to go down, and the cervix is just stays there. It's still attached to the uterus. So let's say the baby's born. Sorry, I'm pulling on the baby. Okay, my cervix would still be here. It would reclose and it would be attached to the uterus, which would go back to its original form, which is the size of my fist, about like this. But that takes many days to go back to that size. But the cervix would still be here, ready for the next baby.